there's more plans to privatise more of the NHS, and this week we saw something that we'd been suspecting was going to happen for a while. I don't know why it was taking so long for them to actually just announce it, but Palantir has won a contract with the NHS. I'm just going to play a short video.
You know, the first step, the thing that seems very odd for an outside observer of Britain is this sort of Stockholm Syndrome people have with respect to the NHS, where it's like they think it is the most wonderful thing in the world, and perhaps the first step is to just understand it as a very iatrogenic institution. You know, there's sort of probably some formula where we can go through all the institutions in our society and think of them as more iatrogenic than healthy. You know, the highways create traffic jams, and welfare creates poverty, and the schools make people dumb, and the NHS makes people sick. And that's what I would start with. I would start by, the first step is you have to get out of the Stockholm Syndrome that it's anywhere close to working, and then there are all kinds of ways you would try to you'd have to go into all the layers, but you'd try to figure out ways to have market mechanisms. You try to avoid rationing. You try to make it less regulated than it is. Those would be my intuitions. Where to go?
When you say introduce market mechanisms, do you mean privatize further?
You'd try to find elements that you could privatize. You would try to, obviously we live in a society where you can't privatize these things completely. So, but even the parts that would be subsidized, you try to find market mechanisms even for the parts that are treated as a form of welfare.
I mean, there you go. That's quite frightening. The guy knows he knows what's good for us here with the NHS. And the story about the Palantir contract is this week. We've also seen this in the media, that Rishi Sunak's lobbyist election guru represents US firm Palantir bidding for huge NHS deals. So lobbyists are involved in this. It's all a bit crooked. And the other aspect that we all have to bear in mind is that Wes Streeting has appeared on platforms with Palantir and is quite happy with this contract. No one in Labour has spoken against it. Can you tell us what the implications are for this?
Yeah, so there's several things to point out. First of all, Peter Thiel's analysis of health systems is based on total ignorance and blind ideology. He comes from a country where millions of people don't have any access to care. He talks about introducing privatization. Well, it's been thoroughly introduced. Maybe he hasn't noticed. And then he says you can't completely privatize. Well, what he means is where there's no profit, the state has to step in. And that's what the Americans have in the form of Medicare and Medicaid. And what they want to do is reduce the NHS to a state-funded service for those people that are untouchable by the private sector. So you push more and more people into the arms of the insurers and private providers. Now, the background for Peter Thiel and Palantir is they're a US spy tech company. They've risen to their massive presence due to very cozy deals with the deep state in America. So, and Snowden pointed out several years ago how these big tech firms are in bed with the state to spy on the public. GCHQ was found to have the biggest covert spy arrangement in the world. So that's already happening in this country. And what I'm afraid is going to happen is this infiltration of these private companies into health data systems will be another pillar of the establishment of a mass surveillance program that this government has, using health as a weak link to get and embed these structures. You mentioned the revolving door. You mentioned the conflicts of interest with the advisor to Sunak working for consultancy Fleetwood Strategy. We also had ex-Tory ministers lobbying for Palantir. This contract has been awarded on a no competition basis. We know that when big tech gets involved in the NHS, it is very weakly regulated. There was a survey done by NHS Digital which found that there were hundreds of serious data breaches where the companies do not respect data sharing agreements. They don't respect confidentiality of individuals within the data set. And the problem with, even though they're found to be having weak systems and weak governance, they pay no penalty. They carry on working with the government and with public services to extract money and profit. And the big danger with medical data is, first of all, most of us won't mind our data being shared if it's in our individual care, if it helps our care. But what these companies want to do is get masses of data and in future not necessarily protect our privacy very well, but put it to commercial use. And the government's guarantees on the protections that go along with these contracts are very weak and very vague. So we must assume that these protections do not exist in a material way. They might exist on paper, but even that's not being spelt out. So, the track record of big tech in the NHS is very poor. We've talked previously about the biggest public sector procurement disaster in terms of tech with Connecting for Health, which wasted tens of billions. Now, this is $500 million, but they have wasted tens of billions in the past and achieved very little. But, from a practicing GP's perspective, they can't even get the basics right. So I have to log into a patient data system to look after my patients. And every week there's a problem with the system. Every week we get locked out of various elements of the system. And this is basic record keeping. So, God knows how much money is going to be squandered and what commercial advantage is going to be extracted by disrespecting our right to our personal medical data being confidential. There are huge dangers with this, and I'm speculating, but I think this will form part of what the government is assembling, which is a mass surveillance platform using digital ID, using your medical records. And if you think what they could do if they merge DWP with health data and use that to sanction disabled people, to say, look, you haven't picked up your prescription, you're in breach of the conditions to get your benefits are going to stop. So there are huge dangers here.